A'udhu billahi minash shaitani rajim. Bismillahir Rahmanir Rahim. Assalamu alaikum everyone to another session of VOTP. VOTP stands for Voice of the People, and the main purpose of this organization is to empower each and every one of us to understand and the importance of one's voice. We not only want to raise accountability and question ourselves to make sure we are doing things as Allah subhanahu wa ta'ala wants us to do, but also demand accountability from everyone in the public offices and of course our leaders. So as a part of VOTP, we have a sister organization called Find Your Truth, which works with significant emphasis on individual empowerment. And in individual empowerment, nutrition plays a very, very, very important role. We have with us Sister Safia Gopalani, who is extremely passionate about improving the health and the nutritional status of each and every one of the Ummah so that we can perform at our best and our highest potential. Today, we're going to focus on the nutrition of kids and infants, and kids from the age 0 to 7. And I'm sure we're going to also cover the prenatal nutrition as well of moms. So without further ado, let me go ahead and welcome Sister Safia. We are, excited to have you here, and we all are excited to learn about this, that you can raise a ummah of strong Muslims who are able to perform in their highest potential. Inshallah. Bismillah.
You guys hear me?
Yes.
Can you see me as well?
Yes.
Okay.
Your screen as well.
Okay. So today we're going to talk about what is necessary to have a baby, because so it's not really like, yeah, babies are fun to play with and all, but we are not inviting, like we're not okay, I'm trying to form a statement here that we are actually inviting a life in this world, right? So
Yeah.
the soul comes from Allah subhanahu wa ta'ala. So it's not just okay, goo goo gaga with the baby, but we're actually asking for a huge responsibility. So we can't just have baby like we're having lunch today, So there is a lot of prep work that needs to go on, which usually gets missed by most of us. So I'm gonna I'm gonna talk about what the mental status and emotional status would be for a parent before the conception, and then what the diet of a mom should be 2 years before the conception, and then like within the 2 years while they decide on having a baby, and then the benefits of breastfeeding, and then some options, and then introduce food to the baby, like outside food besides breast milk. And then we'll just summarize it all, and then we'll take questions. Is that sound okay?
Alhamdulillah.
All right. So I'm trying to figure out to go to the next slide. Oh, okay. Okay. So when a couple decides to have a baby, they get married, they're excited. Well, a lot of things happen, and we all have our backgrounds, right? So basically, what psychologists suggest that we should have, like couples should have, like emotional bonding for babies, for better health of the baby. So we came up with a little plan that they need to have open communication. I mean, communication and relationship and work, and it's everywhere. So yeah, again, here between the spouses, the communication should be very open, sharing hopes, dreams, fears. I mean, we all have past fears. We've seen a lot of things happen, a lot of things go wrong, during pregnancy, at birth, after birth. So share things, share your concerns, voice out your emotions, and then some people might find it difficult to conceive. So these practices help for them as well. Dedicate time for intimacy, and then bond with the partner, which boosts oxytocin, which relaxes you. And then, like when we are sound emotionally with each other, um, obviously that's like the biggest gift we could give to the child, like a secured home, right? So while we have open communication, now we need to have a thankful attitude, thankful to Allah subhanahu wa ta'ala, thankful to the people around us, thankful for the partner, wife, husband, either, um, and talk about all the past traumas, not just like lost pregnancies and miscarriages, but about their individual, like moms and dads, the wives and husband, they all have their childhood traumas there, and abusive spouse, sorry, abusive parent, or they've seen someone being abused, and then they're carrying that burden. So having that stress on them, while they're trying to conceive, could cause a trouble in conception, and it may not happen. So have an open communication, and then practice gratitude with being thankful to the people around us, thankful to Allah subhanahu wa ta'ala for every single thing that we have, rather than focusing on what we don't have. And then, um, psychologists say to approach conception with a renewed sense of peace. So have some peace inside, regardless of what the environment is. Um, because my Jannah is inside me, right? And so it's not just being prepared physically, it's the emotional part that matters a whole lot. Yeah, physically you will look for the ovulation period and all of that. But it's that I highlighted the new chapter in life, because it's not just the two of us, it's the three of us now, or the four of us now. It's gonna be a family. Until now, we were married and we were spouses, and now we are family. So this is a big change. It is a big improvement because, like I said in the beginning, we're not just having baby to play with. We are inviting a soul from Allah subhanahu wa ta'ala inside us. And imagine, like, I'm getting goosebumps right now just thinking about it. So, and then we are taking responsibility of a new life, and we're promising Allah subhanahu wa ta'ala that we will nurture this little human to the best of our ability, so this little person can do great things in life, inshallah. Um, moving on to mm, nutrition part. Are we good so far here? Okay. So moving on to the nutrition. Food is very important. Yes, movement is important. Sedentary lifestyle is no good. Um, but when a woman is trying to have a baby, when a woman wants to be a mother, um, she needs to take care of her diet very much so, and be very active. So the the macronutrients like protein and fat, and the micronutrients, the minerals and vitamins. I listed three, the most critical nutrients that are important, just omega-3. It's a part of omega-3 because omega-3 is made of two components, EPA and DHA. And if you are a mother, you probably know what DHA is. You've probably taken prenatal vitamins already. Um, so we need to have B complex, the oil soluble vitamins, which is A, E, A, D, and omega-3 is cod liver oil. Of most fish contain omega-3, and just meat, animal protein. It's very important, and eggs. So have good macro protein and lots of fat. Omega-3 is good fat, right? So, and zinc is very important for cognitive. I'll talk about another fact, another thing where zinc deficiency is, and you guys will be surprised. Um, so vitamin K2, really, really important. And again, we find that in butter and animal protein and egg yolk, powerhouse. Egg yolk and animal meat is are the two superfoods that Allah subhanahu wa ta'ala has created, alhamdulillah, for us. And fermentation helps a lot in B vitamins. So this is just the overall, this is just the overall picture of that we should have clean diet. This is by no means a diet plan here, right? We'll talk about it more as the questions arrive after. Please write down your questions. Moving on to the next one. Again, the baby is here in the world, alhamdulillah. Now we need to worry about this little human who gets fed through a umbilical cord. Now we need to feed the baby. Can you still hear me?
Yeah, we can hear you. Yeah.
Okay. It's really deafening here from all the noise outside. So breastfeeding, we all know it's super important for the baby and for the mommy. We're just gonna go a quick rundown. Um, it's more than feeding, it's love, care, protection, and connection. Breastfeeding builds emotional security, trust, and lifelong resilience. And so benefits for the baby is that, of course, the natural milk from mommy has perfect amount of protein, fat, enzymes, hormones, and nutrients, what the baby needs actually. And um, here's a little fact that the this milk supply through the breast is not a one-way supply that it just comes out. It has sensors, so as soon as the baby takes the first suck, a little bit of baby saliva goes in too. It's two-way, right? And the factory inside the breast sense that baby is stressed, then the milk will come out, the next gulp will come out with more magnesium. So on and so forth. If it senses that baby is not feeling well, it's gonna have more antibiotics in the second gulp. SubhanAllah, it's just amazing at how Allah subhanahu wa ta'ala has created the 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 clean supply of food, for the baby. And it's good for, yes, allergies, infections, brain development, cognitive growth, and again, emotional comfort. It's just a beautiful thing. Mommies and baby connecting uh, every so often, every 2, 3 hours for a feeding session. It's very beneficial for moms too. Um, when we continuously breastfeed and not do any supplement, it helps our uterus go back to the original size. Um, not so extraordinary bleeding. I mean, you would still have the teaming process, but it won't be extraordinary. And it saves us mommies from all kinds of, female coming cancer and heart disease and amazingly diabetes. Releases oxytocin, of course, which is the bonding, and reduce postpartum depression or prevent postpartum depression, I should say, in most cases. So beautiful natural process Allah subhanahu wa ta'ala has created for us and should always take advantage of it. There are exceptions and we'll talk about it shortly. So a little fact about boys. I read this book named Strong Mother, Strong Son. Dr. Maker's talking about how to raise a son, being mother of a different gender, right? A son or boys. So beautifully, she wrote that um, on mother, how to raise extraordinary men. She mentions from the moment your son is born, he knows that you are different from him. SubhanAllah. Even as tiny human, he realizes on some level that you are his introduction to female love. We have big responsibilities, ladies. When you respond to him kindly, he learns to associate kindness with people, with females. If you soothe him when he's afraid, then females are trustworthy in a very real sense. You lay the foundation for how he will relate to women for the rest of his life. SubhanAllah. Um, you set a template over his heart that will guide his action from his earlier years through adulthood. So I wrote that we mothers need to be mindful when the infant is not the same gender. Girls are very much connected to mommies, but for boys, we have to go extra step. Yeah. So I'll take questions later. I know there are questions brewing in your minds. I had to when I was reading through the passage. Um, Now come the risk, of course, everything that was beneficial, the same thing, all the risk of respiratory infection when we don't breastfeed, when we put babies on formula, ear infection, and then we have great chances of babies being obese, diabetic, kinds of emotional issues, anxiety, depression. Um, and I was surprised to see that there was slightly lower IQ and cognitive issues in the kids that were not breastfed. So I mean, it's our utmost responsibility to feed the baby. Again, there are exceptions, medical reasons. Allah subhanahu wa ta'ala help us all. Um, there was a quote somewhere here. Never mind. And for us, again, it takes a long time for uterus to go back to its original size. And the again, the higher risk for all the risks that were prevented while breastfeeding, now we are at risk of ovarian cancer, breast cancer, and then diabetes, and risk of postpartum depression because of lower oxytocin, because of no connection, right? No skin to skin connection. When mommies feed the baby, there is skin to skin connection. But when mommies are giving formula, they're not touching the skin. They're still fully clothed. So the connection, the pheromones were supposed to be built. That's lacking. So low oxytocin. They're still loving, but there's low oxytocin flowing. Now, the formulas are really not a good thing because it's all based soy based and vegetarian, like plant food, which is really not good for the baby initially till like 6 months old and more so a year old. Um, I pulled together like an just a generic ingredient on one of the formulas, and the ingredients did not look clean. Like this is something I would not put in my body, much less in that little person's body, right? So looking for alternative, I found this website called West westonaprice.org. They have a recipe to create homemade baby formula with cow milk, and they add a few things to it, and then there's a specific temperature. I know it's a lot of work, but this is as close to breast milk that we can get. So I will put the link in the chat if you want me to. And please go ahead and look through. It's a 27-minute video. Go through it and see if you can come up with that formula, inshallah. Um, Moving on. I hope we're good so far, but please write down your questions. Um, then I'm coming up with, oh, so I need to wrap up quickly. Okay. Coming up with infant development guide. So the I found this really cool fact that infant's stomach is the size of cherry, and that's cute. And at day 3, it's the size of walnut, and at 1 month old baby, it's the size of an egg, a large egg. So doctors say that go with the fist size rule. When a clenched fist, as big as the fist is, that's how big the stomach of the baby is. So with very little room to feed, I think it's a good idea to feed the nutrient dense food rather than empty calories. Remember we went through that nutrient dense and empty calories in the first lecture.
Yeah.
So um, so as we introduce new outside food besides breast milk after 6 months, we need to watch for any allergic reactions. So don't introduce all all at once, like one thing at a time, and then watch out for a few days and see how the body reacts to it. Like baby's body reacts to it, the baby behavior. You'll see it in behavior. Um, Totally avoid grains, please. And so their digestive system is still immature, so doctors advise to go slow, don't go all in. The foods to avoid, yes, sugar, honey, because fruits, because too many carbs with very little benefit, it could create food poisoning. And processed food again, lentils and beans, like plant food, are kind of harsh on tiny tummies. And plant-based milk, like we would think, okay, no cow milk, then let's do almond milk. No, that's also plant. Plant will hurt up to a certain point, and then after 1 year, we'll add plants, but not right away. Um, so one more slide here. This is interesting. I can put this PowerPoint in the group if you like. The developmental guide. So at 6 months, um, when the baby is about to like learn to sit with support and show some interest in food, like putting things in mouth, so they can move their limbs around comfortably and they're curious. The best food to give would be butter, ghee. Yes, I know. A lot of people are like, "Wow!" Egg yolk, bone broth, and soft cooked low lactose vegetables. But let's hold on till 8 months, 8 to 10 months for the vegetables. But initially at 6 to 8 months, you can give egg yolk. So cook an egg like half fried, half boiled. So the yolk is not totally raw, but it's runny, and that runny yolk is the best thing for the babies. Don't cook it all, otherwise all the B vitamins will go down the drain. Um, and then at 10 months, we can, introduce vegetable soup. Again, low lectins, go easy. Their tummies are small and very sensitive to anti-nutrients, right? And then we can add some soft cheeses that we can feed with a spoon or with, like fingers. And then after a year, we can add some nut seeds ground up, or just let them pick out and play with it. And they can eat the whole egg, like even egg white. But initially, we'll just start with egg yolk. Yeah, again, remember the tip: introduce one new food every 3 to 5 days and monitor for allergies in behavior, in pulling ears, um, excessive crying, tummy ache, that we call colic. Remember, it's not idiopathic. It comes from plant food. Poor sleep, restlessness, irritability. It's all due to what we feed them. They're not born like that. Okay? Babies are born on nature. So, okay. I got one last thing. So remember I told you about zinc? And when we complain that my baby is a picky eater, it's the lack of zinc. So we need to start giving them some zinc. And again, mommies need to start taking zinc and vitamin D and the omega-3. So the babies would not be born with deficiency, but now that baby is in the world, start giving them some zinc drop, talk to doctor and get the dosage and everything. Yeah. So long-term child nutrition and health throughout. I mean, why let the kids eat junk? Is there a particular reason that we let them go get away, or let them eat like highly processed and food coloring, and I mean their tongues go blue with those popsicles? Like, why? It's not nutritious. So so ketones are very important for the babies to make sure their brains grow and they're alert. Um, Critical nutrients for growth. Yeah, zinc, vitamin B1, and DHA, and we get all of these from an egg yolk in micro dosage. The foods to avoid for kids, of course, it's not just for babies, it's for kids. So up to 14 years old, no fruit juice, no flavored yogurt, no funky shakes, and just don't feed grain. Grain's peasant food. It's not really. Um, I mean, their tummies are so tiny. Why fill with unnecessary anti-nutrients or calories? So healthy meal equal to protein, vegetables, fruits in limits, nuts, and seeds. Oh, and I think this is the end of my presentation. I forgot to add the slide of Q&A, so go ahead and shoot.
Yeah, Jazakallah khairan, Sis Safiya. I think very important. Both you mentioned very clearly the importance of such a big responsibility of bringing a soul into this world, and as well as important highlights of how a mom should take care during her prenatal time, as well as the foods which need to be offered to the baby. I know most of us will have a lot of questions on what practically to do at home. So please go ahead and you can either type in the questions in the chat. We will take that, as well as you can unmute yourself and directly ask your question as well. So go ahead. So, Safi, just to kind of remind myself as well as the audience, the zinc. I know you mentioned its importance. Again, could you remind us of the food items? If I heard it right, it was the meats. Is that right? The processed meats have zinc, or any other vegetables would you recommend?
Food wise, yeah, just meat.
That should give a adequate amount.
At this age, yeah, we're not going to introduce them clams and strong aromatic seafood. So just meat is good and no protein.
And any difference in the type of meat? Is it, I mean, red meat better than the, white meat of chicken, and or
Oh,
any?
no, no chicken, no chicken, no chicken, no
So it's more,
chicken.
you want to, yeah, okay, red meat mainly, beef and
Yes, no chicken. Chicken has too much omega-6, and their little tummies would get bothered. I'm gonna put that Weston oat price in the chat, so just copy it and click on it, play around with it. It has a lot of questions that are answered, and they're not sponsored by big corporates,
mm,
so you can find some good
yeah,
good answers here. Okay, let me open the chat quickly and see if there are some.
we have one question basis.
Yeah, okay, there's a link here. Um, Now some doctors say stop breastfeeding baby if some babies are sick and stop crying or are restless. Well, you don't stop breastfeeding, you stop eating junk. Look, we are mothers. We have um, the level of respect that Islam teaches the kids, but I mean, it comes to the cost, right? So we sacrifice our taste buds because there is Jannah for our kids. In, I mean, it just gives me goosebumps to say that, but you know what I'm talking about, and you know what I'm referring to. Um, so that Jannah under my feet doesn't come freely. It has a cost to it. So I'm going to give up all my bad habits, eat clean, so my baby is fully nourished, so the baby won't cry. So the solution is not to stop breastfeeding. The solution is to clean up my diet. Um, here's a myth, I think, that people are craving for food during pregnancy. There is no scientific fact for it. They just taken advantage of this pregnancy time that nobody's going to say anything. So why not? Let's just call it a craving and go for ice cream every night. What they don't realize is that they are hurting themselves and they're hurting the baby's development. And when they don't have enough D3 in their system, the babies are born with brittle bone syndrome. And then some kids have this leg like, kind of curved, not straight. It's their developmental D3 deficiency. So please, ladies, if you made a mistake already and the babies are already out, start giving them some D3 for stronger bones. Otherwise, at about 7 to 8 years, they'll start to complain that their ankles hurt, and doctors will say it's a growth pain. No, it's a D3 deficiency. It's a vitamin D deficiency that you need to address, that we need to address, of course.
Yeah.
Oops, just one question. Okay, well, it's going to be a short one.
Well, Sophia, can mentioned at the start, you mentioned at the start, that there should be a period of bonding between the spouses. But what we are usually finding is that the person gets married, is sent to the in-laws, the new environment and everything, and within 9 months they are having a baby. So
No prep.
yeah, no prep is what I noticed that you were emphasizing that. And what are the consequences of not having that? Could you talk about that?
Yeah, the development, baby's development is affected. I mean, if you just follow and go, you just got married, you go eat out late nights, and
Mm,
then you get pregnant and you continue to do the same thing, and then you eat ice cream every day in the name of craving. You're going to ruin that baby's life, not just the development, but the emotional aspect of the baby as well. So, I mean, do we not see, not you, sorry, do we not see the the high rate of emotional stress that our next generation is going through because mommies are being careless, like careless times 10 these days. And sedentary lifestyle, doctors put them on bed rest. It's like, there you go. They're not moving. Their babies are not developing.
mm,
Please don't do that. just keep moving. I mean, I'm not saying you drag yourself. I'm just saying that, eat clean so you can move around and not have knee pain or swelled up ankles. And right? Don't eat sugar. Sacrifice, sacrifice, sacrifice. Mothers have to sacrifice to bring a life. Allah subhanahu wa ta'ala, it has mercy on us. Allah subhanahu wa ta'ala gives the ruh, the soul from him into my body, not to men's body, right? So he has more mercy on us women and we abuse it. How is it fair? Is goat milk close to mother's milk? No, it's not. It's not. In the formula, click on that link and they will teach you how to make homemade formula from cow's milk mixed with water, like diluted protein. But no, goat milk would have more allergens than cow's milk. And when they say no cow milk, that means all animal milk out. To the best of your ability, try to breastfeed and please eat clean. Please eat clean, please. Give up grains, give up all the processed food, give up all the food coloring, and just affects baby's life. And that person is going to live way past after your death, like after my death, my baby's going to live past that. And I won't be there to see all the consequences of what they go through, of what I have done while they were cooking inside me.
Hey, what
Okay?
about teething? What about teething? This seems to be a major issue with parents. The child is going through teething, they can't sleep. What is that? Well, how to handle that? What is the best way?
Uh, the the lack of nutrients bother them. So zinc, lack of zinc, um, zinc deficiency, and in vitamin D3 deficiency, cause them to be fussy while teething. Um, so so during that period, mommies need to consume extra magnesium. Magnesium glycinate is the best one. Take extra dose of magnesium. If you're taking 400 mg, take 600, take about 1,000, up to 2,000 mgs. Also, I have seen mommies taking that would calm their babies down. Okay, so you don't feed magnesium to the baby, you consume it yourself, so it will come out in your milk, right? Because when they're teething, you're still breastfeeding, right? About what, 9, 10 months. So that would keep them relaxed. And clean your diet. So as you clean your diet and don't give babies junk food. When I say junk, meaning so there are like kids are given breadsticks and parathas to chew when they are teething. Well, when their little gums are irritated, they just want to put everything in their mouth. Make sure you give them something cleaner, like I don't know what would be cleaner, Farhana.
Like
Like
frozen, yeah,
wash an okra and
yeah,
hand it to them. Like
yeah,
like really wash it, yeah, so that they don't get any pesticide. Instead of breadstick or a toast to nibble on or a
yeah.
cookie to nibble on, give them carrot. They're not gonna choke on it. They won't be able to take a bite on it. So clean up carrot, give it to them. Just let them chew and play around. Introduce vegetables first. Don't start with fruits because once you introduce sweet, it'll be really difficult for them to get the savory taste. And make sure they have enough zinc in their body. You consume zinc, and then if need be, check with the doctor, pediatrician, and get some zinc drops. So you do get infant zinc drops, you know that. Um, so they're not such picky eaters, so they get used to and start to like the sour taste and the bitter taste and savory salt and everything. You start with salt. Don't start with sugar, please. You'll thank me later.
Yeah, nowadays they have a lot of, like, netted or cloth made things which you can put, vegetables and just, and give them to and put in the freezer and for them to suck on,
Oh, so it's all so their gums get now. Cute.
I mean, yeah. They feel little numb. The pain is a little better, and then they can, get the taste of those veggies as well. Yeah, veggies and fruits. Yeah, yeah.
Teething. Okay,
Very,
so we're
very.
just teething. I missed that point. Thank you, Sister Farida. Another question. Some babies don't drink breast milk from the start. What is the reason for that? I don't know. I did not come across that while I was researching this topic. Farhana, do you have
Yeah, no, it's
any?
not that they don't drink breast milk. I mean, initially when the babies are born, the first, 1 to 2 days, they don't need much as well, and hardly, the little few drops of milk comes, which is called the colostrum, and that is enough. So it's not like, milk pouring. So, I think so. Breastfeeding is it takes a little of patience. It takes time on its own to, get the breast working, and that is enough. And Allah made it exactly as Sophia said, the size of the baby's tummy. So, but what we are expecting is we are expecting to see a lot of milk, and our expectation is that's a lot of milk flowing and the baby is drinking. No, it's not that way.
Yeah,
So yeah,
true.
so first, the first week, be totally relaxed and don't have big expectations of them gulping a lot of milk. The cherry, the size of a cherry, so Sister Sophia, very,
Imagine that.
yeah, yeah.
There's a
So
change.
so what typically happens is that the new moms, the first week, I'm not producing, they start feeling guilty. I'm not producing milk for the baby. The milk is not coming. There's not much going to come in the first, 2, 3, 4 days a week. So,
Mm.
so
And
so
those few drops, like you said, of colostrum is enough for them. And babies are born with extra chub. We notice that the chubby arms and chubby thighs, so cute.
good.
They can survive 3 days on that fat. So while mommy's body is trying to get used to and
Mhm.
producing milk and get into the groove, they can survive. They're fine. Don't bring 2 liters of formula and don't introduce that stupid plant food to them, please. They're all synthetic vitamins added to it, and ooh, it's just not a
Don't do,
clean food.
absolutely. Don't get nervous. It'll body everything will come in saying
Oh,
just
yeah,
relax, let bodies do their work.
very natural. Most women don't know the breastfeeding techniques as well. Well, in the hospital, when you go for labor, child labor, is that called child? No, delivery. Sorry, delivery. They teach you there. Nurses, doctors, they're all there to support you, unless you do at home. Well, even if you do childbirth at home, you have what are they called? Midwives. They will teach you. I don't know why it's a complaint that we don't know techniques. We have people around teaching you, giving you, all kinds of trainings, the pumps to get it jump start and all that. So yeah, take advantage of the technology, but do feed them as much as you can. Even if you have a little stream coming, do that. Whatever comes, do them. It's very natural. But you know what, Rana? What I've seen, so many people in their teens and 20s, like, early young woman age, they have done the breast implant.
Mm.
So their milk ducts have been cut
Yes.
off.
Mm.
SubhanAllah. It's just
Allah, that is
now they cannot.
is
Yeah, can you imagine the frustration?
wow.
Even if they go back and take out the implant, the damage done. There's
Mhm.
nothing we can do, right?
Yeah, yeah,
Ooh,
and the
be
and the
very careful what you do
yeah,
with your body.
and the baby's suckling will promote, the milk production,
Yes.
prolactin, and will cause it. So yeah, don't worry about the baby not drinking in the first 2 weeks at all. So just take it
Mm.
easy. Yeah.
So after one feed, when the baby's fussy and crying, don't think the baby is still hungry. Think about what you ate in the previous 2 days, which is coming out through the milk, which is bothering that little one. And again, it's not the baby's personality, the fussiness. it's what you ate is what's bothering you, or you're feeling, if you are not feeling well. Like, I'm not saying that you got ill, but like you are not a happy person, you're just bombarded with outside stress, family. Like Sister Farida said, that they are thrown into in-laws and then 9 months later. So you have so much going on. But for the baby's sake, I have to be very strong. So regardless of what goes on around, I can tune it out. It's like, no, I have to be calm for my baby. So connect with Allah subhanahu wa ta'ala, make that lateral connection, your spirituality. Eat clean. You will have better hold on situation. Your circumstances won't change ever. Or like just because you hope things will change and then you will do better care of the child, that's not gonna happen. That's what I meant ever. Uh, I didn't mean any negative way. Um, so, but the circumstances won't change. But I will have better hold on my situation if I eat clean. You know, I will not have brain fog. I will wake up not stressed, and I will have good night of sleep. I will know how to deal with it rather than just being irritated all the time. And if I'm irritated, the baby's irritated. So
Yeah.
it just goes on. Okay, I guess we don't have a lot of questions because we don't have a lot of young mothers here.
Yeah. So another question is, the gap between the child. I know. So if a mom, is getting pregnant sooner, what kind of nutritional supplements would she need to kind of, get her, healthy fat stores, DHA and all of that up to mark for the next ready for the next one.
Yeah, is there? I mean, yeah, there should be a gap.
Yeah, ideally, yeah,
Once
but
you stop breastfeeding, right? That's when you're supposed to be pregnant. But how does that happen though? Like two kids are like 11 months apart. How does that happen?
yeah, I mean,
I don't know.
it's a breastfeeding usually prevents the ovulation and prevents formation, but
Right?
not
Yeah.
always. Yeah, but sometimes they can be fall throughs. So any particular recommendation for her? Should she kind of catch up on her zinc and meats and all of that?
They need to start taking lots and lots of vitamins and not junk prenatals. Like
Mm.
really go through my label lecture, and I had a slide where I have mentioned for B vitamins which alternative to take, or don't take synthetic alternative, take the natural. Take that slide and get some good supplements. Keep up on your blood work that you're not low in D3, you're not low in any. Keep taking protein so you are not doing injustice to either the baby inside or the breastfeeding baby. And after 6 months, you introduce outside food anyway. So just make sure that you feed the baby enough food so you're only feeding them like, a few times instead of like 12 times, you're feeding 3 times. So your baby inside is getting more nutrients. Don't bulk on stupid calcium carbonate, please. Don't take any multi. It has too much vitamin A. We don't need vitamin A. Just get it from food sources as much as you can. But there are some minerals you can't get because of the soil depletion. So I would highly recommend you take magnesium glycinate, potassium citrate, and then take zinc. Zinc also citrate is good too, or whatever's available. A couple of types of zincs cause nausea into some people, but it's not a big percentage. So just change the kind of zinc you take. You don't have to quit zinc. And make sure to do your omega-3, omega-6 ratio often. So do your blood work every 2-3 months, and so you know that you're in a good health.
Yeah, absolutely. Moms got to be more careful, especially.
Right on time.
Yeah. Yeah. Okay. All right. I think, Jazakallah khairan,
Well,
everyone.
today.
The session. Please forward this to the young moms that you know in your family, and sisters or anyone coming in. So yeah, we have an important session coming on the September the 14th. Please watch out for the flyer. It's going to be by Dr. Muhammad Akhtar, and this is on the raising the unity in the Muslim Ummah sooner than later. And he is he's a physician out of UK, and he's the president of the Muslim Council there in UK. So yeah, please go ahead and forward this everywhere, and then inshallah we will start making some changes. Let's start moving. And let's start raising kids who have the full potential to move at a very faster and a very productive rate, inshallah. All right.
I was expecting like tons and tons of questions today.
Yeah, I know. The moms are quiet today, huh?
I don't see any young mom here. Yeah.
I think they're not in this group. Yeah. Yeah, I think most of them have, older kids, and maybe we all, feeling, guilty about what we kind of not done, but alhamdulillah, nobody's there, alhamdulillah.
Well, yeah, it's not too late to still get your kids' blood work and check out the deficiencies, and
yeah, and spread the word. Be the elder sister in your groups, and your daughters, and yeah, that's, I think, the important step. The future generation, all the young moms around. You want to get them. You want to learn more and teach them more, inshallah. So that's kind of the role we would like all of us to take here. Yeah.
I love Azra's spirit. She says, I'm not a young mom, but I'm getting myself aware for others now. That is so sweet. Thank you, Sister Azra.
Yeah.
It's a sweetheart.
Yeah, that's kind of the role we're going to be, inshallah, playing, inshallah.
Okay. Yeah. So it doesn't start after birth. It starts before conception. 2 years, mom needs to take clean diet. And like doctors in the United States, they quit alcohol 2 years before you plan to have a baby. It's a big step for them to give up alcohol, right? I mean, yeah, motherhood doesn't come free. So,
No.
thank you for giving me the opportunity to talk about it. It was such a humbling experience to researching and all that.
Alhamdulillah. Alhamdulillah. Very, 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 very valuable lessons here. Alhamdulillah. And yeah, please fill in the survey form, and any questions, any topics you would like to know more about nutrition or health from Sister Safiya, please let us know. We can request Sister Safiya to help us in those areas. And please fill in the survey form before you log off. And again, reminder for the session coming up on September 14th. So, أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. السلام عليكم ورحمة الله وبركاته.
السلام عليكم.